So hi, everyone. My name is Jillian Schneiman, and I'm a medical student at McGill University. I'm the project lead with the Saving Lives with Pride campaign, which is run by the Stem Cell Club, a donor recruitment organization in Canada. And I'm also a member of the Canadian Queer Medical Student Association. So today I'll be talking about my presentation called Advancing a More Inclusive Transplant System for Gay, Bisexual, and Other Men Who Have Sex with Men. Gay, bisexual, and other men who have sex with men, perspectives on barriers and facilitators to donation, and key considerations for running gay, bisexual, and other men who have sex with men donor recruitment campaigns. I want to thank my supervisor on this work, Dr. Warren Fingret, and as well my co-authors that are listed here. So gay, bisexual, and other men who have sex with men have faced a long history of barriers to inclusion as donors. Although they have been eligible to be stem cell donors, they have been largely excluded from recruitment efforts and therefore represent an untapped donor pool. 2 years ago, the Stem Cell Club launched a Saving Lives with Pride campaign. Which was done in collaboration with individuals who identified as gay, bisexual, and other men who have sex with men. And so we developed multimedia resources in collaboration with people from the LGBTQ plus community and demonstrated that when these multimedia were shown to a cohort of gay, bisexual, and other men who have sex with men, they improve knowledge and attitudes towards stem cell donation and reduce barriers to donation as well. And so extending from that work, the objective of this project was to explore gay, bisexual, and other men who have sex with men, perspectives on barriers and facilitators to stem cell donation to inform efforts to engage these individuals as donors. So for this project, we ran 12 focus groups with 37 individuals from the LGBTQ plus community. All were between the ages of 17 to 35 years old, with 70% having non-European ancestry, all identified as gay and bisexual, and included LGBTQ plus community leaders and members, people living with HIV, and transgender people. Only 3 of the participants were previously registered as donors. And in these focus groups, an array of multimedia from the Saving Lives with Pride campaign was shown via shared screen. And then a group discussion followed, which was facilitated by a moderator. And we used a constructive grounded theory approach to develop an understanding of participants' perspectives on barriers and facilitators to gay, bisexual, and other men who have sex with men stem cell donation. So this is an example of some of the multimedia resources that were developed for the Saving Lives with Pride campaign that were shown to participants. So all were developed in collaboration with LGBTQ plus individuals and groups from this community. So on the left, we have infographics, which engage gay, bisexual, and other men who have sex with men to register as stem cell donors, which highlights their eligibility to register, as well as addressing sensitively and without stigma the question of whether people living well with HIV can register as stem cell donors. In the center at the top, we have examples of TikToks and videos developed with LGBTQ plus advocates to engage this community to donate and educate them about donation. And then at the bottom, we have video statements from transplant hematologists, which emphasize that LGBTQ plus individuals are wanted and needed as donors and will be treated with respect by the donation teams. And then on the right, these are multimedia and story arcs, which feature stem cell donors and recipients who identify as gay, bisexual, and other men who have sex with men. So I'm going to walk you briefly through some of the things that we found. So we found that there was a lack of awareness about stem cell donation among gay, bisexual, and other men who have sex with men. In particular, participants shared that they were unaware of their eligibility to be stem cell donors, with many confusing stem cell versus blood donor eligibility criteria. We also found that exclusion from and stigma around donation was another barrier. Participants expressed frustration and anger due to their exclusion from blood donation, which negatively impacted their attitudes towards donation of any product. Importantly, we also found that participants were concerned that gay, bisexual, and other men who have sex with men would not be treated well by the healthcare system. And these concerns stemmed from a lack of trust in the healthcare system, from prior negative experiences, with participants fearing that disclosing their gender and sexual identity to the transplant team would lead to discrimination or mistreatment. Participants also highlighted facilitators that engaged them to stem cell donation. So they were really inspired and empowered by multimedia that emphasized that gay, bisexual, and other men who have sex with men were wanted and needed as donors. Participants especially valued reassurance from healthcare providers that they would be treated well as donors, with special value if this messaging came from the entire team rather than just one physician. Participants also valued multimedia, which featured members from these communities advocating for donation and highlighting those from the LGBTQ plus community personally impacted by donation. Participants also emphasized the importance of multimedia that reflected the diverse plurality of the LGBTQ plus community rather than overemphasizing one image. Participants also shared important considerations for campaigns engaging gay, bisexual, and other men who have sex with men to donate. So they emphasized the importance of clear messaging, which included explaining the rationale for specifically engaging LGBTQ plus communities, providing information regarding the campaign's development and timing, and ensuring that the language used to describe gender and sexual minority groups is appropriate to the context. Participants also provided important guidance on discussing HIV in the context of the campaign, sensitively and without stigma. They appreciated the campaign's infographic, which provided a clear and appropriate phased rationale as to why those living with HIV and with an undetectable viral load cannot donate stem cells. With respect to timing of the campaign, participants highlighted that the campaign should be run throughout the entire year, in addition to during Pride festivals. And participants also encouraged the campaign to partner with LGBTQ plus community groups and members to help spread the word to as many people as possible. So in summary, our work guides the engagement of gay, bisexual, and other men who have sex with men to donation. Our analysis is relevant to recruitment organizations, registries, and transplant centers worldwide as they work to advance a more inclusive transplant system. And moving forward, we hope to explore barriers and facilitators to donation for other gender and sexual minorities, such as trans, non-binary, and gender non-conforming people. And then we also wish to emphasize that work to advance inclusion is not only important in the context of donation, but is also needed for patients seeking hematological care in the clinical context. Thank you.